senior as a surgeon or physician, then maybe you may be talking in some forum where lot of people from other countries are coming. Your pronouns should be correct. Sciatic nerve and sciatica. This is this is posterior cutaneous nerve of the arm. Very long nerve runs at the back of the. Ideally, this nerve is coming in common with the sciatic. Sometimes it pierces the piriformis and appears. These are very little variations. So it's there.
Can you summarize the muscles in the gluteal region?
Gluteal, you still doubt. Gluteus maximus is here, right? Then gluteus below the maximus is
Medius and
medius, which is this one, and below this is minimus, which should be underneath this one. Okay, maximus, medius, and minimus. Okay, yeah. So which is anterior and which is posterior?
anterior minimus and posterior medius.
Yeah. See, this gluteal region is this one, right?
Yeah.
Like this. Okay. Like this, right? And this bone here is this bone. Okay. This insertion here is here on the gluteal tuberosity. This mass, which is attached on the femur, is coming here. Okay. Rest of this is going to iliotibial tract. Majority of the muscle fibers, 3/4, are going to the iliotibial tract. Only small little part goes to the bone on the tuberosity. Okay. So gluteus maximus is inserted on the most posterior plane because it is the most posterior muscle. If I close this and if I touch it, the first muscle I will touch will be gluteus. If I close this and if I touch, the first muscle I will touch will be maximus. So means it is most posterior. Under the gluteus maximus is gluteus medius. So its attachment will be on a little bit more anterior plane. That's why you are having medius attached here. Attachment of minimus will be even little bit more anterior, somewhere here. So can you show the attachments here?
This is medius and
Medius.
more anterior minimus.
And where is the minimus?
Gluteus minimus.
Minimus is anterior.
Yes.
Behind is medius.
Behind is medius.
Medius and behind is the maximus,
Right.
isn't it?
So
Why I am emphasizing this is more posterior, this is more anterior, most anterior, because the action will change. If it is exactly posterior, the action on a hip joint will be
posterior extension.
extension. Very good. Okay. And if it is most anterior like here, then the pull of fibers of muscle will be like this. Abduction. Abduction. And little bit rotation, but mainly abduction. So see, the names are sounding similar. Gluteus maximus, gluteus minimus, gluteus medius, but the actions are different. Difference comes out because of site of insertion, whether it is most posterior, little bit anterior, or most anterior. So that's the point. So medius and minimus are mostly abductors, mostly abductors, as compared to maximus, which is mainly extensor. Okay. But the anterior most fibers of the maximus are located on a more anterior plane. So these fibers may be having little bit minor role in abduction. Don't mention that. Majority.
Between maximus medius and insertion of maximus, there is a quadriceps femur.
This is quadriceps. You can very well clearly see maximus, medius, but you are not able to see the minimus because it is hidden underneath. Behind. This is quadratus. See, there are two muscles which sound or pronunciation is similar. One is quadratus femoris Other is quadriceps femoris. Quadriceps is here,
Anterior compartment.
and and quadratus is here in the gluteal region. Quadratus means having four sides. One, two, three, four. Quadratus. Quadriceps. Sep means head. Quadriceps means muscle is having four head. One for rectus, one for vastus medialis, intermedius, and latalis. So don't confuse when you tell this is not quadriceps. This is quadratus. Quadratus. Pardon? This is inserted into femur. It's very simple. There was a bone here. This belongs to other side. That's why it's making problem. So the muscle will come directly from here to this one. Okay? I can't do it. So we have to take other. There is a bone here. Muscle fibers come directly like this. Okay? So only four sides. Yeah.
This is right.
I think this is okay. This is fine now. Now you can see. Okay. Very good. That's how the muscle fibers go. Like this. So it is having four sides. And you can see four sides. They come from hip bone and go to the greater trochanter. So this elevation is produced by quadratus femoris. Quadratus femoris. Got it?
This nerve, superficial.
Yeah, one is superficial peroneal nerve. The other is this one. This is your deep peroneal nerve. This will enter to supply the anterior compartment muscles, the tibialis anterior, peroneus tertius, and extensor digitorum.
I mean this one.
Pardon? Yeah, this is very important nerve. Very important. This is a cutaneous nerve. It is present always on the lateral side of the leg. Very long cutaneous nerve. This is known as sural nerve. Sural nerve. This is usually used by neurologists. They take a sural nerve biopsy for diagnosis of the neurological diseases and so on. So they just give a small little incision in the neck, open it, take a small little piece of the sural nerve. It is sensory, pure sensory. It supplies the skin on the back of the leg and lateral side of the leg and lateral side of the foot up to here. Sural nerve. Okay. It's arising from this. It's a branch of the tibial. Tibial. Yeah. Yeah, you can see it. It's coming from the tibial. Sometimes it has got another twig coming from common peroneal as well. That's a rare variation, usually from the tibial. Tendocalcaneus. Yeah, tendocalcaneus. Achilles tendon. Achilles
Could you
tendon.
explain about muscle?
The four muscles here. Yeah, four muscles in the superficial group. Okay. Medial and lateral head of the gastrocnemius, and then a big thick muscle, the soleus. 3, and 4th is in between the two, known as plantaris, which is phylogenetically a degenerating. It's just like palmaris longus, with small belly at the top and very long tendons. It's sandwiched there. So 2 heads of the gastrocnemius.
Gastrocnemius, medial and lateral head.
Lateral head and medial head of the gastrocnemius. Then you have got plantaris underneath it, and then soleus. All the four. This is thick part is soleus. This is medial head. This is the lateral head, and this mass belongs to soleus. Plus you got plantaris. All the four. In some cases, plantaris. No, plantaris is you have to go deep and see. In some people it is absent. All the four unite to form what is known as tendocalcaneus, which is inserted into the calcaneus.
Action dorsiflexion.
It's dorsal. No.
Plantar. Anterior
You
compartment.
walk with maximum force. Here.
Multiple layers.
And then this superficial group, and then there's a deep group where you have got tibialis posterior, you can see it. Okay? And then you have got the flexor and lucis longus going to the big toe, and you are having one more. Two more superior toe at the top. No, not superior toe. Popliteus. Popliteus at the top. Popliteus, tibialis posterior, man, and flexor, flexor. That's it. So your flexor retinaculum on the medial side, which is medial side. This is medial side. This is flexor retinaculum. This is flexor hallucis longus tendon. This is tibialis posterior, and popliteus is at the top here, on the lateral side. Flexor hallucis tendon goes to the big toe. This is your flexor hallucis longus tendon.
This
It passes under the flexor retinaculum. This is your tibial nerve going under the retinaculum.
tibialis posterior.
And there should be an artery as well, the tibial artery, posterior tibial artery. So the structures passing under the flexor retinaculum are posterior tibial artery, the tibial nerve, flexor hallucis longus tendon, the tibialis posterior tendon. Right? The location of the flexor retinaculum in the foot is on the medial side, while in the hand it's located on the anterior side. That is the difference.
Okay. Anterior compartment. Leg.
The compartment is here. You can see it's having tibialis anterior, first muscle, it's tibialis anterior. Then you are having these four tendons coming from extensor digitorum longus. This is your extensor digitorum longus, four tendons. And then there is one more muscle which is known as peroneus tertius. Peroneus tertius. So you see, 1, 2, 3, 4. These four tendons belong to extensor digitorum, while this tendon is peroneus tertius. This muscle is, you see, this muscle is peroneus tertius.
In the lateral aspect.
Not in the lateral space. This is anterior
Close to
part.
the lateral.
This name is misnomer because its action is eversion, so you use the word peroneus, but its site of location is in the anterior compartment. So it dorsiflexes as well as it everts the foot. So this is your peroneus tertius, this is your extensor digitorum, and this is your tibialis anterior. Nerve supply of all of these is your deep tibial, right? And on the lateral side here, you are only having two muscles in the lateral compartment. Peroneus longus. It's a very long tendon which passes under the foot, crosses the foot completely, very deeply in close contact with the cuboid bone, and it's attached on the base of the first metatarsal. It goes like this. It's very long, that's why it's known as longus. Okay, so it grooves the cuboid, which is the lateral bone. This is medial, this is the cuboid. So you can see there is a groove under the cuboid. Okay, this groove under the cuboid is produced by this this muscle. So the peroneus muscle comes from lateral side, and then it goes obliquely, crosses the foot, and will be attached on the base of the first metatarsal here. So the muscle will be like this. Getting that? Getting that? So that's why this is long, and it is a very prominent tendon. Below this is another muscle, peroneus brevis, and it will finish here. Okay, it will finish here. Can you see it? It is the base of the fifth metatarsal. Are you looking at the difference? It's base of the fifth metatarsal on the top of the dorsum. So this is short. Lower muscle is short. So it's known as peroneus brevis. And on top of it is a very long muscle. This is known as peroneus longus.
Inserts into a
And both of these are on the lateral side, so they will lift the lateral border of the foot, or eversion. Another everter is this one, peroneus tertius, but this doesn't belong to the peroneal compartment. This belongs to the anterior compartment. Nerve supply is different. Here both of these are supplied by superficial peroneal, while the anterior compartment is supplied by the deep. Class.
Thank you.